we're delighted to welcome to the program a guest who we haven't spoken to before, Dr. Amandeep Hansra from the Australian Digital Health Agency. Doctor, thanks so much for your time and welcome.
Thank you for having me.
Now, you've got a message out. I guess you're wanting people to be a bit more aware of their health. You think maybe with the floods and the pandemic, people are perhaps, maybe overlooking their health a little bit more than they should?
Yeah, look, absolutely, Peter. I think it's been a tough couple of years for most people and they've got a bit of COVID fatigue, and that's actually distracting people or putting them off seeing doctors for other reasons. So it's really important that we keep getting that message out, that we don't delay health checks and people don't put their health on hold while dealing with other things that are going on. But we do understand the challenges that people are experiencing at the moment.
One of the great things, of course, that's come into the being, if you like, because of COVID and things like that are the telehealth consults. But I guess, literally there's nothing like a face-to-face consult, and also getting to get those checkups that are so vital.
Yeah, look, absolutely. I mean, we've been very lucky that during the pandemic we were able to use technology, and so telehealth has been really, it's a saving grace for us during that pandemic period. We've done over 100 million telehealth services and 17 million patients who've received those services. But it doesn't matter which way you access your healthcare provider. It's really important that you keep doing that. You get all your, usual heart checks and diabetes checks and your cancer screening. All of that still needs to be done. We really don't want people putting that off.
Now, we're playing devil's advocate, Amandeep. Is there a little bit of responsibility maybe back on the doctor?
Yeah, look, I think we're certainly trying to get the message out, trying to encourage people to come back and really giving them options in terms of how they access us. So now that we know that telehealth is kind of here to stay, really want to encourage people to have that option if they can't get to their doctor. If there's, obviously, we've had some big challenges with the floods and people travelling and, not being able to get to their doctor in person. We so really encourage those people to reach out to their doctor, and if they want to do it via telehealth, that they do, ask for it to be set up that way. I think, most doctors are offering it, but if yours isn't, really worth having that conversation and asking them to provide the healthcare services to you that are the most convenient.
I guess things like the floods and the pandemic, they're also issuing or bringing up mental health challenges as well.
Yeah, look, I think the next sort of wave of healthcare challenges for us is really going to be around mental health. I think a lot of people have been impacted significantly, and it's not going to be a short-term impact. I think that's going to go on for some time. And again, we can provide those services remotely to people who can't get to a healthcare provider in person, whether that's your psychologist or your psychiatrist or your GP. And the other thing to note is that we can also send prescriptions electronically. So if people are struggling to get to their doctor, their medications are running out, with people who are on, antidepressants or anxiety medications, not to stop those because they can't get access. We do have great technology that allows us to continue those things with 50 million electronic prescriptions that we've issued since 20th of April as of 20th of April 2022.
They're very impressive numbers.
Yeah, and I think it's just showing that the public are embracing the changes that we've had to make, and those changes, are really here to stay, because COVID won't be the last challenge that we have facing communities in accessing healthcare. I'm sure there'll be other things that will crop up, as we've seen with the floods and we saw with the bushfires, a few years ago.
And things cropping up. I guess we think about the flu. We're sort of coming into the southern winter, particularly in many states in Australia. Flu shots are now very much top of mind as far as next thing to do.
Yeah, look, absolutely. We are aware that people have a bit of vaccine fatigue as well, a bit over having to have vaccines, administered to them. But we really do want to encourage people to visit their GP. They can get their flu shot the same time as their COVID shot. And we've already seen large numbers of flu coming through, more than we've had the whole of last year already, and it's April. So we're going to probably have a bit of a challenge in terms of impact on our healthcare system if we've got lots of people coming into hospital with flu-related illness as well as COVID-related. So just encourage people. I know that you're exhausted, but please visit your doctor and get your flu shot.
Well, of course, being exhausted probably doesn't help your immune system, so maybe you need a bit of support there. With the flu, particularly this year's strain, if you like, seems like it can be pretty virulent. I know a number of people that have had it said, they've had both COVID and the flu. And the flu seems to have been worse in terms of side effects or impact than COVID.
Yeah, look, I think what's happened is last year we were actually a bit we weren't exposed to the flu strains that were around because we obviously were locked down and we didn't have a lot of flu circulating. So in a sense, we're a little bit naive. Our immune systems are a bit naive to the flu viruses, the strains that are floating around at the moment. So it's a bit like we're out of practice in dealing with it. Normally we have some level of immunity, which is why, again, the vaccine is important because we've gone for a couple of years not having that practice in responding to the flu strains. So we do encourage people, go and get that flu shot. That'll cover the strains that are circulating this year. But yeah, I've had patients of mine who've had flu worse than they've had COVID in terms of symptoms. So really encourage people to get that shot.
Now, I think I'm suffering from a bit of date fatigue or time fatigue. I think it was last year when the COVID shots became available that people were encouraged to have a couple of weeks between COVID shots and flu shots. This year, it's okay to have them at the same time?
Yeah, absolutely. Same day, different. You can have them on different arms. Just get it over and done with. Don't have to go visit the doctor twice. Definitely go and get them done at the same time. Your bodies, we've given lots of vaccines at the same time when you're children and you go through your normal immunisation sort of schedule. Most children get multiple vaccines on the same day. So these are ones that you can have together.
Amandeep, they're two different shots though, like you can't have... one
it's
shot,
not,
two doses?
It's not combined yet, although
okay.
we're hoping that one day that there will be a release of a vaccine that has them all combined, but not as yet, not for this season anyway.
You probably don't want me to go down the social media stuff, but some of the stuff that was out there regarding the vaccine and maybe its side effects, are we kind of far enough now into the situation to know that they are pretty minimal, both short-term and longer term?
Yeah, look, I mean, we've had obviously, billions of doses administered worldwide. And you've got to remember, this isn't just an Australia thing. This is not just our population that we've got in terms of data. We've got data from all over the world. And, we've never really administered a vaccine at that scale to that many people at the same time. So we actually have a lot of information to study in terms of side effects and, impacts ongoing. And obviously we've had some time now since we first started the vaccines. And I think we feel, safe in saying that there's been nothing untoward or nothing, that's sort of raised any concerns or red flags that, we made the wrong call. I think we certainly, feel like it was, all appropriate actions taken at the time in terms of accelerating these vaccines through the approval processes. And, I'd encourage people to continue to trust in those. The science has been there for us and we've saved millions of lives. I think it's important for people to know that this has had a positive impact and we're hopefully coming out of the other end, but we still got to be mindful that we need to keep that immunity level up.
And just going back to the flu and the COVID shots at the same time. So this is for pretty much anyone. I mean, obviously many of our listeners would be older. I think some of the young kids, maybe it's not recommended, but sort of anyone, sort of adult and onwards, if you like, it's okay to have both the booster or if maybe you're still up to your third shot, and the flu shot, it's okay to have any of those together.
Yeah, look, I mean, talk to your GP about it. The flu vaccine is free under the National Immunisation Program for those over 65, pregnant women, children under 5, Aboriginal and Torres Strait Islander people and those with certain chronic medical conditions. So that eligible group can walk into a pharmacy or a GP and get that vaccine. If you are worried about, any concerns about having both together or you've got a specific medical condition that you want to talk to the doctor about first, have that conversation with your GP before you have it. But, we do recommend it for all people, but the flu vaccine, is free under that National Immunisation Program for those particular cohorts.
And Amandeep, I asked this question a little bit tongue-in-cheek, so please understand that. But do you think you and your GP cohorts have done any more reading in the last 12 to 18 months than you've done in your life?
Oh God, yes. It's been a task just keeping up with all of the science. I mean, you can imagine we've had to keep on top of all of the research and the data that's come out with COVID, and then keep up to date with everything else that we normally have to do as well. So it is a workforce that's been under significant pressure over the last couple of years. But we really have to thank the public and everyone else that's got involved, and media, and we've had a lot of support, and also government and some of the tools they've given us. And we talked about telehealth and the e-prescribing, the My Health record. All of that has really helped support our work so that we can continue taking care of the public.
Well, as a member of the media, I've got to say that the doctors have actually been really, really good. Obviously, we've chatted to many of them over the time, particularly in the last couple of years, and they've always been very freely available, given the fact that they're obviously very, very busy. You've been so today, so we thank you for that. We wish you well. It'd be nice to chat to you again. Often we speak to Andrew Rochford from the Australian Digital Health Agency, but I think I'd rather speak to you, just to put Andrew back in his place.
Thanks so much. I'll let him know.
Hey, please do.
Great chatting to you, Peter. Thank you.
That's Dr. Amandeep Hansra from the Australian Digital Health Agency. Don't